Okay, I'm going to get going because we've got quite a lot to get through today. Welcome to this mHabitat hosted event being delivered in partnership with the West Yorkshire and Harrogate Health and Care Partnership. We've got quite a range of people here from across the patch, from local government, national and local NHS organisations and the third sector. We've got mostly people from either a digital transformation type background or digital inclusion related background. And today we're going to begin to explore inclusive digital transformation in health and care across West Yorkshire and Harrogate. The objectives of the event are going to be about shining a spotlight on the really good practice in digital inclusion across the area and building connections and networks of people with an interest in inclusive digital transformation and identifying key priorities going forward for inclusive digital transformation. I want to emphasise that this is the beginning of the conversation. So my name's Ros Davies and I'm the Managing Director at mHabitat. We're a co-design digital inclusion and innovation team, and we're hosted by Leeds and York Partnership Foundation Trust. Our mission is to ensure that everyone benefits from digitally enabled health and care. Now, before I introduce the session a little bit more, I just wanted to give a shout out to Digital Access West Yorkshire. So they're a charity in Leeds who take unwanted devices, they wipe them clean, and they issue them to people who really need them. And they're currently running a campaign called Tech Angels to help young people in Leeds. They also need things like chargers and memory sticks, etc. So can I just ask if you or your organisation can help them, please get in touch with them. Their website address is up on the slide. It's www.accesswy.org, or you can give them a ring. It's 077 56 56 0193. And they are a fantastic organisation doing really important work around digital inclusion. So I'm going to start with some housekeeping. This session, as I mentioned earlier, is being recorded. If it all goes well, it will go up on our site in due course. Can I just check if you've joined us? Can I just check when you've joined us? Can you make sure that your full name is on the corner? And if you haven't, you just need to look up at the little 3 dots in the top right corner and rename. This is important because it helps us to with the technical side of getting into breakout groups later on. So if you're sharing on social media, could you use the hashtag #InclusiveDigitalHealth? If you do not want to be seen on a screenshot today, please keep your video off. And can I just get everybody to just check that everyone has got their mute buttons on? And can you try and keep this on at all times until you get into the breakout groups, please? Use the chat function to add your comments and insights and feedback and chat with other participants and ask for help. Now, you've got a reactions button that I think is down at the bottom of your screen. If you want to show your appreciation, feel free and use a thumbs up. And if you've got something to say, then use the clap function. We've got quite a lot to get through today, so we may not have time to take comments or questions in the main room, but there will be plenty of time for discussion in the breakout groups. I think I can hear somebody's voice, so please do check your mute buttons on, please. I'm going to run through the event schedule in a moment, but just to give you a heads up, we will be spending some of our time as a whole group in this main room, and then there will be 2 breakout sessions. When we get to those, you'll be invited to enter the room. I'll be letting you know, and then you'll be invited to enter the room, and you click the button, and you'll be magically transported into the breakout room. There will be a member of the mHabitat team in every room, and at the end of the breakout sessions, you'll be magically transported back into the main room. So. Oops, sorry. So the agenda. I'm going to spend a few minutes introducing this event and the background behind it now. We're going to hear from some really brilliant people who are going to give us a 5-minute quick fire summary of their digital inclusion work. And it's really varied actually. And I'm really pleased that we've got these 5 groups of people in the room today. After this, we're going to go into a breakout session, and this will be your chance to listen to more about their work and to ask some questions and hear their stories. There'll be a facilitator in the room to guide the conversation. And then you'll be returned to the main room where our facilitators will share up to, I don't know, 3 points which have emerged from the conversation. Probably if you need a quick comfort break, that might be a good time to take it. And then we're going to go into a second breakout session where we will start to think about, from a health and care perspective, in our places, what are the barriers and levers and priorities around digital inclusion and inclusive digital transformation. And that might be from a local perspective, or it might be from a region-wide West Yorkshire and Harrogate perspective. We'll then return again to the main room, and the facilitators will share the priorities that they've heard. And we'll start to see if there's any themes emerging across the patch. And then finally, we will talk about next steps and close the event at 3 p.m. So I'm just going to give you a little bit of background around why we think that inclusive digital transformation is important, and where we're our starting point. So even before COVID-19, digital transformation was seen as a big part of the future of health and care, with an £8.1 billion investment price tag. But the COVID-19 crisis has clearly acted as a catalyst for fast-tracking the use of digital in health and care. From remote consultations and monitoring to the use of apps for people self-managing their conditions. And obviously there's the use of big data and machine learning to improve the efficiency and effectiveness of health and care. So there's a serious and inherent problem in this strategy. A digitally enabled health and care systems at risk of compounding health inequalities, as I think many people listening here today will understand. In the UK, there are 9 million people who struggle to use the internet, and nearly 2 million households who don't have access to the internet at all. And these people are more likely to be vulnerable, older, living with disabilities and living in poverty. And those groups are more likely to need health and care services. So you can see there's a big flaw in the plan. If we don't put inclusion at the forefront of our plans and our actions. So this is our sort of version of the risk factors involved in digital exclusion. I think it's important to really understand the problem that we're trying to solve here. And there is plenty of research out there, but it tends to focus on individuals as opposed to the whole picture and system. And what we're trying to articulate with this slide is that there are 3 interlinked risk factors, and all 3 of them are really important. The first is the life context for people. So your physical and mental health background, your income, your life opportunities are all really important factors of digital exclusion. And actually, digital exclusion is really a social exclusion issue. If you're homeless, or if you're living with severe mental health conditions, or you're suffering from domestic violence and abuse, there will potentially be very complex barriers to digital inclusion. So the second factor, I think, is quite well known. It's about digital skills and confidence and motivation and access. And people refer to things like data and digital poverty. So this isn't a simple issue either. So people may have a device, they might have access to Facebook or what have you, but they may have low health literacy and knowledge and not have the skills to use digital to, for example, manage their own condition with apps, etc. And we could do a completely whole webinar on the issue of people understanding the power and potential of their health data as well. And then finally, I think this is an often forgotten factor, is the system. So how digitally enabled tools and services are designed really matters, in terms of accessibility, user experience, etc. And the staff skills, confidence and motivation in using digital really matters as well. And not just how they use it, but how they support other people to use it. So patients and people who are using services. And then finally, it really matters how digital is integrated and embedded into patient pathways and healthcare services. So digital exclusion is what's known as a wicked system problem. This means that it's really complex and messy, that there's interconnected factors and it's really difficult to solve, and that there isn't one silver bullet or one route to solving the issues. But that really doesn't mean that we shouldn't, and that we can't and we shouldn't act to improve the situation. But it does mean that we need to understand the whole picture, and that there will be intended and unintended consequences to all our actions. And it also means that it's really important that as a system that we work together to achieve common goals, and that we understand this is a people and relational issue. So inclusive digital transformation is about more than individual activities. It's about making a whole system cultural shift. And it's about valuing grassroots activities, but it's also about clear leadership commitment to ensuring that people who are digitally and socially excluded will not be abandoned as we continue to move to a digital first society. So we think that an important place to start is to understand the current picture together and map out the stakeholders, the assets, and understanding the levers and barriers and local priorities, and recognising that we're not starting from a blank page, which is why we're all here today. So what we hope will emerge from today and wider discussions is an understanding of that current picture, including what good practice exists in our area, and how to identify shared priorities. And the West Yorkshire and Harrogate Healthcare Partnership will be considering these discussions and wider evidence and conversations, and have committed to funding a demonstrator inclusive digital transformation co-design process. So we will be working with a cohort of more digitally and socially excluded people and co-designing an enhancement to an existing or planned digitally enabled service. And I know South Yorkshire and Bassetlaw and Humber and Coastal Vale ICSs are also committed to running a demonstrator project alongside this. And mHabitat have a number of other related activities going on. And we really hope that by the end of this financial year, we'll have delivered a number of those demonstrator enhancement projects, and they cover themes ranging from remote monitoring and consultations to chatbots, that we will have supported a number of local systems to have made cultural systemic changes towards more inclusive digital transformation, and we will have produced hopefully a set of assets which will be freely available on a Creative Commons license. That's our plans in the bigger picture, and this picture I hope shows us where we want to get to today on our journey. So I'm going to stop sharing my screen. And I'm going to hand over to Dawn Greaves in a moment to introduce herself and to set a little bit of context from a West Yorkshire and Harrogate health and care perspective. Over to you, Dawn.
Thanks, Ros. Great introduction there. Yes, so I wanted to just give a little bit of context as to why within West Yorkshire and Harrogate we've agreed to do this work and partnership with mHabitat. So we'll all know about the journey that we've been on since COVID, the amount of digital technology that's been thrown out quickly, in some instances for staff, in some instances for patients. And we've had to do that quickly due to the nature of where we are at the current time. But now we need to really focus on what does that mean for our staff and our citizens, and are people actually able to benefit from the things that we've put out there? So for instance, we have 98% of our GP practices offering online consultation for patients, but are patients actually using it? If they're not, what are the reasons for that? Is it because they physically can't? Is it that they don't want to? There'll be many reasons, but we need to try and get to the bottom of understanding that and trying to relieve some of the barriers that are out there. So we know, for instance, we've got large cohorts of people where English is not their first language. So automatically they've got a barrier before they can start to even think about whether they would want to use the tools. What kind of solutions might we be able to put in place to resolve that for people? And also people with disabilities who physically aren't able to type into a form, for instance, or access the tools that they need to be able to do. We want to make sure that for our citizens, we're making it as accessible as possible, and that everybody has an opportunity to interact if they choose that that's what they would want to do. As part of planning for our phase 3 since COVID, we ran some World Cafe sessions within the ICS where we brought all our places together to look at what plans they want to put in place to move services along and reoperationalise some of the services. And every single place highlighted digital inclusion as a particular issue for them and something that they wanted to focus on, which is fantastic for us as a digital team, because that is something that we'd already written into our digital strategy when we wrote that last year. At the time, we knew we needed to engage a piece of work to start to progress, but we didn't really know how we were going to go about it and what it would cover. But the fact that the places are now telling us that this is a real focus for them gives us that drive and ambition to really move it forward. I think that's why now's the right time to embark on this journey and move collectively. Also, we work across Yorkshire and Humber as a whole, so not just within the West Yorkshire and Harrogate boundaries. And as part of the work that we're doing around shared care records across Yorkshire and Humber, we have developed a health and wellbeing charter which covers the 3 ICS areas, so West Yorkshire and Harrogate, Humber, Coast and Vale and South Yorkshire and Bassetlaw, who Ros mentioned earlier. And we've all signed up to a charter which talks about how we're going to deliver services for our whole populations. And one of the streams within there is around digital inclusion. So again, we have the background policies in place, but now is just moving us to the right time to be able to progress and move things forward. So we are quite keen that we learn from each other. So we are very much aware that there is already a lot of work taking place within the region. We're not belittling that at all. We really want to showcase all that work that's going on, because there'll be other areas that could really benefit just by taking advantage of the work that's already been done there and learning from the lessons that were done there, and enabling that spread, but also opening the boundaries. So again, it's not just from a West Yorkshire perspective, we can learn from the other areas that have done other work as well. So what we want to do is, again, showcase what's happening, but try and identify where are the priority areas that we need to focus on. So where do we really know there are some inequitable areas that we could do some work on to try and resolve that collectively, and let's start that plan of action. We're going to have to focus on a few areas, but I'm hoping from today we'll almost come up with a long list of things that we want to progress on, and then we'll come up with a priority as an ICS in terms of which are the first things that we're going to embark on, but almost developing a longer plan of work, because this is just not a single point in time. This is something that needs to be built into our everyday working. Every tool that we develop, it needs to have this focus around it. So we need to look at how we make it more sustainable and really build it into our transformation plans moving forward. So this is the start of our journey, and I do really appreciate everyone attending, and hopefully you'll all have an opportunity to input and you'll get something out of this as well. So thanks very much, and I'll hand it back to Ros.
Thank you, Dawn. Losing my voice there. I just want to check, just to make sure everybody knows that if we can't see your name on the little tab, if you've got, I don't know, your child's name or something like that, and we won't be able to put you in the group that you've asked to go in. We'll have to sort of choose a group for you, which is not the end of the world, because all these things are fantastic, but just so you know that. For the next half an hour, we're going to listen to these 5 stories of digital inclusion from across West Yorkshire and Harrogate. We have people working on different aspects of the challenge, from building individual skills and confidence, overcoming digital and data poverty, and using co-design to increase accessibility, and all are homegrown. So as you're listening, please do add your insights into the chat, and feel free to big up these amazing people on the chat or on social media. Each one of them is doing fantastic and impactful work. They've only got 5 minutes each, and frankly, we could run a whole event on each one of them. I'm really delighted to be shining a spotlight on these people and their fantastic work today.